Hi, this is Jeff Zeig. I'm the founder and the director of the Milton Erickson Foundation in the offices of the Milton Erickson Foundation here in Phoenix, Arizona, with another 5-minute tip for improving your practice. In the last two segments, we talked about two components. One of those was how do you establish goals? Another component is how, once you know a goal, what it is that you can communicate to the client, how can you gift wrap that goal? In this third segment, we're going to talk about tailoring. How do you individualize the treatment so that it reaches the client? And when I started the Milton Erickson Foundation, it was 1978 that I first asked Dr. Erickson if I could organize a conference in his behalf. When he did accede to that, because it was a way of my saying thank you to him, he had been my mentor intermittently. I started in 1973, and then I moved to Phoenix, Arizona in 1978. I asked Dr. Erickson for a quote for the initial brochure that would, in 1979, that would talk about the essence of his work. And what he wrote was that each person is a unique individual. Therapy needs to be tailored to the uniqueness of the individual and not to the Procrustean bed of a hypothetical theory of human behavior. The bed of Procrusteus in mythology is that the traveler was stretched to fit the bed or cut off to fit the bed. Erickson was unique about individualizing the treatment. One of the most profound contributions of Erickson was developing a new therapy for each patient. And when Margaret Mead wrote a tribute to Dr. Erickson, they both turned 75 in 1976, she wrote that one of the most distinguishing characteristics of Milton Erickson was his ability to individualize treatment. Whereas Freud had a determinant, I really don't know, 12, 13 cases that he added to the literature. Erickson added hundreds of cases to the literature, all based in individualizing. Understanding the perspective that the person takes, understanding this person's experiential language, understanding how does this person interact in the world, and understanding the uniqueness of that. When you read Erickson, pay attention. Now, how do you individualize treatment? That's not something that's so easy, and you may want to develop some categories for understanding how to individualize treatment. A category that you could begin to play with is how does this person perceive the world? Does this person perceive the world more visually or more auditory, more tactily? Is this person more externally oriented, more internally oriented? Is this person more focused, more diffuse in their way of attending to the world? Once you understand how the person attends to the world, you could begin to think about processing operations. Whereas attention is basically unconscious. We don't pay attention to how we pay attention. Processing can be a little bit more deliberate, a little bit more intentional. So we can process things in ways that are very linear. We can process things in ways that are much more mosaic. We can process things in a way that we enhance what we perceive. We can reduce what we perceive. And I find those distinctions very helpful in giving me some compartments to think about what is the position that this person takes, are the habitual patterns, so that I can tailor the uniqueness to the individual. Once you understand some of the individual patterns, you also need to understand some of the interactive patterns. We're looking for both an intra-psychic and an interpersonal assessment. Once you have the assessment, as curious as it is, that may be your starting place for creating an effective psychotherapy. Whereas most people would think we could start with the goal, we can start with the technique. One of the things that I often do is to start by understanding how does this person live? How does this person experience his world? Once I understand the tailoring, then I may better understand the goal, then I may better understand the process, then I may better understand the gift wrapping, how to present information in a way that reaches the human heart, the way that reaches this unique individual. In the next section of 5-minute video, we're going to look at the process and fill out a model with 2 more steps, both the process and also the posture of the clinician. This is Jeff Zeig with a 5-minute video.